Hello everyone. Today our topic will be about postpartum hemorrhage, which is the leading cause of death in pregnant women in developing country. There is many definitions. Some would say that is a blood loss that excess 500 ml in vaginal delivery or 1000 ml in cesarean delivery. But actually, regardless the mode of the delivery, more than 1000 ml of blood loss or any amount of blood loss that lead to sign or symptom of hypovolemia, it is regarded as postpartum hemorrhage. It's considered postpartum hemorrhage. Postpartum hemorrhage have actually two types. One is called early or primary, and the second one would called late or secondary. The primary is when occur within 24 hours after the delivery of the baby. And the secondary one would be from the 24 hour after delivery of the baby to the 12 week. We have causes that mainly at primary time, and some causes are at the secondary time. Uterine atony is the most common cause of postpartum hemorrhage, taking about 80% of all causes. Uterine atony can occur in cases of patients suffer from polyhydramnios, microsomic baby due to DM. There is a prolonged labor that lead to exhaustion of the muscle. In cases of a twin pregnancy also, or even triplet pregnancy. Second cause would be a retained product of placenta. Actually, retained product of placenta can also lead to uterine atony because that retained product will prevent the uterus from contraction. The third cause is a trauma. Trauma will lead to genital tract laceration that will lead to excessive bleeding. So there should be vaginal examination after delivery. Fourth cause would be coagulopathy. And the last one, and it's very rare, but it is high mortality, which is uterine inversion. It is top emergency, and in simple way, it is when from the inside the uterus at the top of it, which is the fundus, coming out through the cervix, and in its severe type, it will come out even out the vagina. That's what uterine inversion is. These all are mainly at the primary time, primary postpartum hemorrhage. For secondary postpartum hemorrhage, the main causes are uterine infection, also same as primary, it is retained product of a placenta, and same as other causes, but the very rare cause in secondary postpartum hemorrhage is choriocarcinoma. It's actually very rare but very dangerous. For the management, if patient come with excessive bleeding and within the first 24 hours usually, so the treatment would be as an emergency, consisted of a teamwork that include obstetrician, anesthesiologist, hematologist, and we have to follow the APC protocol that include 2 IV line with 2 white bore cannula, and we should have 20 ml of a blood sample taken from the patient to take for blood group and cross match. And also we should look for the vital sign, and we should give her IV fluid until we have the blood. We should prepare 6 units of a blood, whole blood, O negative, until we know her blood group. As we said, uterine atony is the most common causes for postpartum hemorrhage, but actually we didn't say uterine atony is the most causes that could be preventive. And the preventive measures include active management of the third stage of labor. That includes oxytocin 20 unit that we put it in 1 liter of normal saline infused at 500 ml per hour. Okay. Also, immediate breastfeeding may enhance uterine contractility and decrease blood loss. But if we diagnose uterine atony, then after we do all of above resuscitation method, we should begin immediately uterine massage. Uterine massage is actually rubbing the uterus with one hand at her abdomen, placing the thumb in front and the finger behind the fundus. In the cases of the blood still profound, we go into second method that include bimanual compression. Bimanual compression, the right hand would make a fist and insert into vagina at the anterior fornix, while the left hand would be at the abdomen, compressing the posterior wall of the uterus. Okay, and we should also give a uterotonic agent, but please stop, don't give unless you are sure, you are confirmed that is don't have genital tract laceration, because it could lead to severe bleeding that unable to stop. The uterotonic agent would include oxytocin, methyl argonovine malate, and donorobrastone, 15-methyl prostaglandin F2A. Either used one of them or all in combination. Let's say in cases of all of that fail, but actually 90% of women will be survived by these only two methods above. Okay, and the bleeding would stop. But let's say that 10% fail to stop bleeding. We go into surgical method that include balloon tumbinate, which is include Bakri balloon, and the other method, which is uterine compression technique. It's actually very preferable in resources that include a B-lanch switcher. There's actually a brilliant video about B-lanch switcher, so please watch it. Other technique would be arterial ligation that include uterine arterial ligation or uterovarian ligation and internal iliac ligation. But let's say that all of these methods that we said is failed and we couldn't able to stop bleeding. Then actually the last technique would be, it's not actually a technique, and the last resort that able to do is hysterectomy to the patient. It's actually so sad, but the excessive bleeding, or sometimes there would be a uterine rupture or even sepsis, so because of an infection, so we don't have any other method. That's actually not all about postpartum hemorrhage. That is only part of postpartum hemorrhage. I wish you enjoyed during that explaining of it, and if you want more, please ask me about that, and thank you. That's all of it.